Welcome to Toledo Clinic TV. We'll spend the next couple of minutes talking about occupational therapy, and our guest is an occupational therapist, Sara Tusing. Thank you so much for being with us.
Thank you.
I think the first question right out of the gate is, what is occupational therapy and how is it different than physical therapy?
So we get asked that a lot, but actually occupational therapy, we specialize in helping people get back to their daily occupations. It's not simply just getting you back to a job. Yes, that could be part of it, but occupational therapy can also help you with getting back to your daily occupations, things that occupy your time. So whether it be getting back to a job, getting back to being able to take care of yourself, being able to take care of your children, being able to take care of family members, driving, even something as simple as being able to use your hands to brush your teeth, comb your hair, get yourself dressed. Basic self-care skills, we can help people get back to doing that. But also more higher level skills like the driving, cooking, cleaning, laundry, all of those types of activities. And we identify what it is that's interfering with being able to do those activities and help you come up with a plan to get back to being independent.
What sorts of patients come to you?
So we would typically see at the Toledo Clinic hand injuries. I would work with patients with shoulder injuries as well, anything like a wrist fracture. We would also cover things like tennis elbow, golfer's elbow. We would do things like frozen shoulder. We could work with patients with carpal tunnel syndrome. We could work with patients with a broken finger, any type of general tendinitis in the arm. So it covers a wide spectrum of types of conditions that we can work with.
Do patients typically come to you as a way to avoid more invasive treatments, or is it in combination with some of those treatments, or both?
They do actually. They like to excuse me, they like to try conservative methods like therapy first before they have to jump into any sort of surgeries. So they might come to us and say, you know, I really don't want to have surgery on this right now. What can we do to decrease my pain?
Okay. And when it comes to splinting or putting braces on, and is that something that you help with? You fit those and come up with the best solution?
Yes, we do. And we would identify, you know, what in the hand or in the elbow is hurting, and if a brace would be appropriate to assist with decreasing that pain. And if there's nothing off the shelf or over the counter that can be appropriate for them, then myself or another OT would custom make a brace for their hand. And it would be something that would be removable, something that they can take off, put on as needed throughout their day.
Do most patients come to you as a referral, or is it something where someone can think, oh, I'm having trouble with doing whatever in my daily life, and can self-refer and say, you know, I think I might need the help of an occupational therapist?
Yes, ideally, we would like to get a referral from the doctor, and it could come from either a primary care physician, it could come from a specialist like an orthopedic doctor, a rheumatologist, a neurologist, or even, you know, your family practice, your primary care physician would be able to refer you to therapy. So if a patient is thinking, you know, I'm having some trouble doing this or that, or I'm having pain with doing this or that, then they would speak with their doctor and see if OT would be appropriate.
I'm sure it varies greatly from patient to patient, but what's the average length of time that someone might spend in occupational therapy?
I would say it varies anywhere from 2 weeks to 4 weeks for some of the more complicated cases. Say, for example, if you had a wrist fracture, you would maybe spend 6 to 8 weeks in therapy, sometimes a little bit longer. It really too just depends on what you're trying to get back to doing.
Okay, good information. Thank you for being with us.
Thank you.